This module is about the social determinants of health, advancing healthcare in America. What are the determinants of health? Objectives for this lesson include an appraisal of the social determinants of health to understand their impact on health when aging, healthcare for those who are older, and how we care for older adults as clinicians and/or caregivers. Consider how COVID-19 impacted the social determinants of health and what could have been done differently so that you can become a social activist for those activists for healthcare for all, regardless of their social determinants of health. The World Health Organization defines social determinants of health as the conditions in which people are born, grow, live, work, and age, including the health system. The structural determinants and conditions of daily life constitute the social determinants of health and are responsible for a major part of health inequities between and within countries. So what goes into your health? 40% is social economic factors like education, job status, family and social support, income, and community safety. And 10% is impacted by the physical environment, and 30% are health behaviors such as tobacco use, diet and exercise, alcohol use, and sexual activity. So that makes up 80%, which impact health outcomes. The other 20% of persons' health and well-being is related to their access to health care and quality of services that they receive. Social determinants of health include economic stability, like employment, income, expenses, debt, medical bills, and support. Your neighborhood and physical environment, like housing, transportation, safety, parks, playgrounds, and walkability. And also education, like literacy, language, early childhood, vocational and higher education. And also food, like hunger and access to healthy options. Another is community and social context, like social integration, support systems, community engagement, and discrimination. And finally, the healthcare system. Things like healthcare coverage, provider availability, and linguistic and cultural competency, and the quality of care. All 6 of these social determinants of health can impact a person's health outcomes, which include their mortality, morbidity, life expectancy, healthcare expenditures, health status, and functional limitations. So these include, as I stated, education, health behaviors, social support, violence, food, housing, employment, and transportation. So where we live can determine how well we live and is a significant factor in life expectancy. This map shows life expectancy at birth and the number of years from age 66 to 87 in the red to blue spectrum across the entire country. As you can see, place matters. Your zip code where you actually live also influences health. Short distances to healthcare services or not can provide a gap in healthcare. So zip code matters. Community also matters and plays a role in how long and how well you live. An example of this is the homicide rate by Chicago neighborhoods or Brooklyn neighborhoods. Drastically different, even though in the same city, demonstrating that community matters. Food insecurity is a risk factor for various health issues, including chronic diseases, poverty, unemployment, homelessness, and developmental delays in children. This map shows an example of 2 big differences. In Illinois, you can see there's 11.7% rate of food insecurity, as compared to Alabama, where there is a 21.5% of food insecurity. As you can see, across the country, food matters. How healthcare impacts health status is very important. There are three main elements: cost, access, and quality. Cost is very important because some people are or are not covered by health insurance, and then there's a variation in types of benefits, and also how much cost sharing there is, or how much people have to pay out of pocket, or how much debt they owe. Access is also very important because along with financial, social, and cultural barriers, healthcare coverage often determines how easily individuals obtain medical services. As you can see, U.S. healthcare coverage is shown in the figure graph here, where 55% are employer health covered. That means their employer has the health insurance plan. 19% are covered by Medicaid, 17% by Medicare, 9% are uninsured, 7% pay for their insurance individually, and 1% are other types of programs. And the third element is quality, which is based on your health outcomes and quality of life. So just to repeat, cost, access, and quality of healthcare are all important for social determinants of health. Health disparities are differences and/or gaps in the quality of health and healthcare across racial, ethnic, sexual orientation, age, religion, and socio-economic groups. Disparities cause differences in disease, health outcomes, or access to care. Disparities in healthcare are differences in preventive, diagnostic, or treatment to certain races or ethnicities, includes raciality, accessibility, and quality with providers when there is failure to act with certain groups, such as with vaccinations, treatment of pain, infant mortality, as well as many other conditions. The cost of health disparities is also vast. Here are some different types of disparities. Premature death can cost an additional $1.24 trillion. And reduction in indirect costs associated with illness and premature death of minority health inequities, if they were eliminated, there would be $1 trillion savings. There's also potential reduction in direct medical care expenditures if minority health disparities were eliminated. That's estimated to be at $229.4 billion. There's a 30.6% excess direct medical care expenditure for African Americans, Asians, and Hispanics that are due to health inequalities. So you can see the cost of health care disparities based on the social determinants of health are extreme. So improving health equity is important. There are 5 key components that health organizations can do to improve health equity in communities they serve. They can make a strategic priority out of health equity and develop structure and processes to support health equity work. They can also deploy strategies to address the multiple determinants of health on which healthcare organizations can have a direct impact, and decrease institutional racism, and develop partnerships within community organizations to improve both health and health equity. Significant disparities in life expectancy and other health outcomes persist across the U.S. Healthcare has a significant role to play in achieving health equity. While healthcare organizations alone do not have the power to improve all of the multiple determinants of health for all of society, they do have the power to address disparities directly at the point of care and to impact many of the social determinants that create these disparities. Healthy People 2030 is a plan that the U.S. government has to address these issues. It's a place-based framework that outlines 5 key areas of social determinants of health. They're looking to reduce economic stability for those not in school or working, and reduce the proportion of those living in poverty so that they have economic stability. In regard to housing, they're trying to reduce the proportion of those that spend more than 30% of their income on housing. In regard to nutrition and healthy eating, they're trying to reduce the number of households with food insecurity and hunger. And very importantly, regarding healthcare access and quality, they're trying to increase the proportion who receive recommended evidence-based preventive healthcare, reduce emergency department waiting times, and the proportion of people who do not get medical care and prescriptions when they need it. They're trying to increase the number that have a primary care doctor and the ability of that PCP and behavioral health professionals to provide high-quality care to patients who need it, and to increase the proportion of adults whose PCP checked understanding, English proficiency, and involved them in decision-making, and also to increase access to online medical records and exchange among providers and access to the information, and include telehealth, and also to include those with health and prescription insurance. And lastly, to reduce the proportion of people who do not receive dental care, eye care, or hearing aids. All of these elements are very important to support healthy aging. The CDC also has resources to address the social determinants of health. Programs across CDC recognize the importance of the social determinants of health to the health of the population. These programs work across sectors such as housing, education, and transportation, and in partnership with communities, because working together can have a greater impact than working alone. These program examples are listed. The Built Environment and Health Initiative, designing and building healthy places. Choosing self places for early care and education, or the National Program to Eliminate Diabetes-Related Disparities in Vulnerable Populations. Partnerships to improve community health, or racial and ethnic approach to community health. And finally, reaching people with disabilities through healthy communities. Depending on your socioeconomic status, these programs may be important to healthy aging. And notably, in 2020, COVID-19 occurred at a much higher rate in those with poor social determinants of health. So what can you do? You need to raise awareness about social determinants of health now that you understand what they are. For healthcare professionals, the benefits of this increased awareness and understanding is obvious. The more doctors and nurses and administrators and those that decide policy and understand the impact of social determinants of health, the better prepared they'll be to understand patients, ask the right questions, and effectively communicate to patients about their health. Though they may appear small, these changes have the potential to ultimately improve overall health outcomes and develop a greater understanding of the context within which health occurs, can enable public health and healthcare professionals to more effectively improve the health of individuals and families and communities. For the public, like you, this understanding can encourage a more holistic view of one's health, potentially leading individuals to ask more relevant questions of their healthcare providers and even make substantial lifestyle changes. Transforming the conditions in which people are born, grow, live, work, and age for optimal health and mental health and well-being is what healthy people, a healthy community, a healthy environment, and a healthy society are built upon. The key elements of this are prevention, mental health services, culturally linguistically appropriate and competent services, income security, housing, neighborhood safety and collective efficacy, environmental quality, and healthcare, developmental child development, education, and literacy rates, food security and nutrition, built environments, and discrimination and minority stressors. All of these are needed to overcome the detrimental social determinants of health. In summary, health disparities are differences or gaps in the quality of health and healthcare across the social determinants of health. To address these disparities, which can cause differences in disease, health outcome, or access to healthcare that support healthy aging, we need to be addressing these issues. Disparities in health status are higher rates of health status in some races, such as higher rates of hypertension in African Americans, or notably the higher rate of COVID-19 that occurred in 2020. Whereas disparities in healthcare are differences in preventive, diagnostic, or treatment to certain races or ethnicities and includes irrationality, accessibility, and quality with providers when there is a failure to act with certain groups, such as with vaccinations, treatment of pain, infant mortality, as well as many others. So notably, attention to each of the social determinants of health needs to occur and be addressed, closing the gap in the quality of health and healthcare, a daunting task to assure that all aging Americans can have healthy aging. Thank you.